Parasympathetic innervation of the heart is primarily controlled by what nerve? A. The cardiac nerve. B. None of these is correct. C. The vagus nerve, CN10. D. The recurrent laryngeal nerve. The answer is C. The vagus nerve, CN10. The vagus nerve provides the main parasympathetic innervation of the heart. The recurrent laryngeal nerve, a branch of the vagus nerve, innervates the majority of the intrinsic muscles of the larynx. The cardiac nerve is part of the sympathetic innervation of the heart. What coronary artery supplies left atrium and left ventricle? A. The left coronary artery. B. The septal branches. C. The left circumflex artery. D. The posterior descending artery. The answer is A. The left coronary artery. The majority of blood supply to the left atrium and left ventricle is provided by the left coronary artery. The septal branches and left circumflex artery are smaller divisions of this main artery. The posterior descending artery supplies the posterior one-third of the interventricular septum. A nurse is performing an abdominal exam and notices a strong pulse in the abdomen just above the umbilicus. She is most likely palpating what blood vessel? A. The femoral artery. B. The exterior iliac artery. C. The inferior mesenteric artery. D. The abdominal aorta. The answer is D. The abdominal aorta. The nurse is most likely palpating the abdominal aorta. This vessel is large, generally 2.5 to 4 centimeters in diameter, and a strong pulse can often be felt on palpation. The femoral artery is also an area where a pulse may be felt, but it is only palpable in the mid-inguinal point of the inner thigh. The exterior iliac artery branches off of the abdominal aorta below the umbilicus, and the inferior mesenteric artery is a minor artery and is not generally palpable on examination. What is the formula for finding cardiac output, CO? A. Cardiac output equals stroke volume divided by heart rate. B. Cardiac output equals stroke volume multiplied by heart rate. C. Cardiac output equals ejection fraction multiplied by heart rate. D. Cardiac output equals ejection fraction divided by heart rate. The answer is B. Cardiac output equals stroke volume times heart rate. Cardiac output is the measure of the amount of blood that is able to circulate through the heart in 1 minute. It is found by multiplying the stroke volume times the heart rate, in beats per minute. The ejection fraction, another important measure of cardiac function, is not considered when calculating cardiac output. Oxygen-poor blood flows from the dash to the dash. A. Vena cava. Left atrium. B. Pulmonary arteries. Right atrium. C. Vena cava. Right atrium. D. Pulmonary veins. Left atrium. The answer is C. Vena cava. Right atrium. Deoxygenated blood from the body flows through the superior and inferior vena cava into the right atrium of the heart. From there it enters the right ventricle, then is ejected into the lungs via the pulmonary arteries. The blood is oxygenated in the lungs, then flows through the pulmonary veins into the left atrium, then into the left ventricle to be pumped back out into the body.